And here with the answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So as far as fruit juices go, do you look for something that has less sugar? Do you add water to it to kind of dilute it? Do you avoid them altogether?
Not necessarily. I think the idea is processing. I've talked about that on this show a lot, and trying to get the viewers to understand that anytime anything is processed, whether it be food or a juice, there's typically going to be additives. Sometimes extra sugar is added to get just the right sugar point so that it tastes good. High fructose corn syrup has been around for many years and has been included in a lot of the processed foods, and a lot of science is coming out indicating this is not so good for the average person. And I think if you have a beverage for a child, you want to try and limit or stay away from those juices because they kind of get accustomed to drinking those types of juices. And over time, when you're at work and they're at home and there's a fridge full of juice, they probably will drink it like it's water, and then there goes the calories, there goes the weight, and there goes the diabetes. So I think try to get them drinking other things that are good for you, which has never changed in many years. You know, the Leave It to Beaver days, milk was big back then, but water, it's never going to change. Juice is good, but just try to limit it because of the issue with calories and weight gain.
Okay, we've got lots of viewer questions. Let's get to those. One viewer wants to know, why doesn't Texas have medical marijuana? There have been plenty of studies that show it has therapeutic qualities.
That's a politician's question. I'm not a politician. You know, it's still a political hotbed. Some states are allowing it, but for right now, it's still illegal in Texas. So.
Okay. We'll leave it at that. Another question, rheumatoid arthritis runs in the family. My grandmother has it bad. I have horrible pain in both feet. They are sore. They also swell at times. Could this be a sign of rheumatoid arthritis? I'm 33 years old with a 7-month-old baby.
Yeah, absolutely. I think anytime you have joint pain, stiffness, swelling, it doesn't go away, it gets worse. You have a good family history. I think that's a good consideration. Blood tests and x-rays should be able to help diagnose that problem.
Okay. If you have a brain infection, can it be fixed, or will you still continue to have those symptoms for the rest of your life?
You know, that's such a broad term, broad description. There's some brain infections we can treat like bacterial. Some we can't, like West Nile virus, and it just depends on how severe the infection is. Even with bacterial infections, with proper treatment, you can be left with some residual neurological deficits, especially if it was a severe reaction. It could even kill you. Same thing with West Nile. We don't have treatment, but if it's a slight infection, you might walk away scot-free without any neurological deficits.
Okay, another question. What causes people to have boils?
A good old staph infection, MRSA, MRSA. It's never going away with this hot climate like it is. We're outside, a lot of friction, heat. We have good antibiotics. Sometimes there's some over-the-counter spreads that you can put on your skin to help reduce the bacterial load so you can reduce the frequency of the boils.
I don't think whether you're outside or not, just going into your car to your work, you're still going to have the heat.
It's really everywhere, this type of infection. You don't necessarily have to be in a high-risk area. So certainly if you have that reaction, maybe get on some antibiotics because this thing can get pretty bad. You might need surgery.
Ooh, okay. One of my fingernails is black. What does that mean? It doesn't hurt, it just is black.
It could just be trauma. May not have remembered traumatizing the finger. It could be medication adverse reaction if you're on Plavix, aspirin, or Coumadin. Certainly could be poor circulation. You know, a lot of people have heart disease and arterial cardiovascular disease, which can cause blood clots to travel to the small circulation of the fingers and turn them black. So a whole host of things.
All right, we've got lots of other questions, so we'll get to those in just a minute. Don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back to answer more of your medical questions. This person has a thick, crusty spot at the top of their scalp, and their hair has stopped growing. What could it be? It
probably could be an autoimmune issue. We get that sometimes on our skin. Injections of the scalp with steroids normally helps a lot. Could be certainly skin cancer, always an issue with any type of lesion on the scalp, especially if you don't have any hair or there's a lot of sun exposure. So certainly get that checked out. It sounds serious.
Okay, another question. A 69-year-old woman has a scratch just above both ankles with a small hole fluid leaks out of both. What could it be?
Sounds like an ulcer, and it sounds like with the fluid that maybe she might have some issues with circulation, whether they be the arteries or the veins. There are x-rays that we can do to figure that out. She might have both. Certainly I wouldn't leave that without getting some medical attention. That small hole or ulcer can turn into a major issue, sometimes major surgery, amputation. So she certainly has some disease going on and needs to be properly diagnosed.
That sounds scary.
Absolutely.
What could cause someone to swell up like she's pregnant when she drinks wine or even a wine cooler?
You know, people don't think of alcohol as a toxic substance, but it is, and some people have really bad reactions to that, and I think that's the reaction. And certainly the simple answer is just don't drink alcohol. I mean, in terms of the exact A to B, probably we don't know, but certainly if you have some symptoms after drinking alcohol, just stop.
Could it be an allergic reaction almost?
If she was having sneezing, or maybe if her mouth was swollen, or she developed a rash on her skin, then maybe. But certainly this is some sort of unusual reaction to alcohol consumption. There are some people who do have redness, diffuse redness on their skin when they drink alcohol. So I'm just assuming it's something related to the alcohol, and just don't drink it.
Okay. What are the symptoms of lupus?
A lot of times you can just get joint pain, stiffness and swelling, just like the previous person who sent in something, rashes. You could also have kidney failure, heart failure, lung disease. It's a diffuse disease, an inflammatory condition, but most of the time patients present with just severe pain, stiffness, and skin rash.
Okay. 29-year-old female, the doctor changed her high blood pressure medicine. Now her left arm tingles. Is this related?
I think it's always possible, but a lot of times it's not. In my opinion, if you start a new medication, you develop a new symptom, then you have to stop that medication, try something different, because possibly it is. Anytime you go to the pharmacy, you get 100 pages of possible side effects, and it may just be on there, and you may just have it. So I think the smart thing to do is to discontinue the medication, get with your doctor.
Okay. A man had blood pressure medicine changed. Now his ankles are swelling. What could cause this? Here we go. Another question just like it.
It's a big problem, and I think every person who has medicines, every time you go to your doctor, you should go over your medication list to review that. But absolutely, if something is new, get with your doctor. We may ask him to actually tolerate that blood pressure medicine. If we've tried other things and nothing is working, we may be able to add another medication to counteract that. So just get back with your doctor if anything happens.
Okay. This person has constant chest pain and pain in their neck. The doctor says it's just stress, but it happens in bed or in the shower and even while they're just relaxing and watching TV. Is this truly stress?
I think it's possible, but you have to get a proper evaluation. Blood, x-rays, EKGs, CAT scans, things like that. If all that is normal, and yes, you're under a lot of stress, new mom, new job, then absolutely stress can be the cause, and certainly get with your doctor to get some prescription medication.
All right, Dr. Levine, as always, we appreciate you stopping by.
Yes, ma'am.
And you can always visit our website and see the answers to these and other medical questions posted online. And you can have Dr. Levine answer your medical question. You can mail your question to the address listed on the screen. You can fax us at 892-7305. Email us at laf@kfdm.com or post those questions every Monday on our KFDM News Facebook page.